Hi, my name is Crystal. I'm a respiratory care student here at Miami-Dade College. Today I'll be teaching you about tracheostomy care. The objectives of tracheostomy care is to maintain a patent airway and skin integrity, also to prevent infection and tube displacement. The indications is for any patient that has a tracheostomy tube would require tracheostomy care. The contraindications for tracheostomy care is any patient who has unstable vital signs. The hazards for tracheostomy care include tachycardia, hypoxia, hypoventilation, bleeding, atelectasis, and any signs of respiratory distress. Now to begin, before you begin tracheostomy care, you will go ahead and verify your physician's order. My physician's order says tracheostomy care, so I'm going to go ahead and do that on my patient. I will go into the room. I will introduce myself to my patient and let them know what it is that I'm going to be doing. Now, what I'm going to do next is I'm going to go ahead and wash my hands for 15 seconds. And then I'm going to don my PPE, which is my gloves and my gown. Okay. Next, I'm going to go ahead and gather my equipment of what I'll be using, which is my BVM bag. This will be used to suction my patient, to hyperoxygenate my patient. Then I will also make sure I have an extra trach tube, because just in case anything happens during the procedure. Also, I have my tracheostomy care kit. Okay? So what I'm going to do is go ahead and sit my patient up in the bed in the semi-Fowler's position. Okay? Next, I'm going to go ahead and monitor his vital signs. I'll be looking for his heart rate, his respiratory rate, his pulse ox, and his breath sounds. Next, after I have monitored that to make sure they are normal before I begin the procedure, I'm going to go ahead and hyperoxygenate my patient for 30 seconds before I begin to suction. So I've done that, so now I'm going to put this out the way. That way I can create my sterile fill, so that way I can make sure I'm doing a sterile procedure while I'm doing trach care. So I'm opening the box. And this is the padding. The padding, the side that I touch, I'm going to place that side down. Okay. So next, I'm going to go ahead and dump all of the things out that comes in a tracheostomy care. I'm going to dump that out. Now everything here is sterile, so I'm going to get my sterile gloves and I'm going to don those. So I'll open them up. Okay. I'm going to make sure that I'm careful the way that I don my gloves to make sure I keep a sterile feel. So I'm going to open this side up and stick my hand in, making sure I don't touch the sterile side. Then I'm going to take my sterile side and go on the inside of the gloves so I'm not breaking my sterile fill. Okay. Then I'm going to put this hand inside. Okay, so now I have my sterile gloves on. So next I'm going to point out to you everything that comes inside the trach kit, which is my saline water, my sterile water. I'm going to do 2 compartments of sterile water, this one and this one. Next, I have my 3% hydrogen peroxide. Okay, I'm going to put that in the big compartment. I also have my trach collar, my 4x4 sterile gauze, and I also have my 4x4 pre-cut gauze. I also have my suction catheter, which I would use to suction my patient after I hyperoxygenate him. I also have a scrub brush to scrub the inner cannula, and I also have these cotton applicators to go ahead. This will help me get into the crevices that I can't get into with the gauze. So I'm going to go ahead and start. I'm going to move my table. So this is my container. So what I'm going to go ahead and do is unlock the inner cannula. I'm going to take it out, making sure I don't touch this part because this is where the mucus is. I'm going to go right here and dip this in the hydrogen peroxide, and then I'm going to get my scrub brush and I'm going to scrub the inside of the cannula. I'm going to also scrub the lumen to make sure I get all of the mucus out of there. I'm going to dip it back in the hydrogen peroxide, then I'm going to dip it in the sterile water to rinse it, and then dip it in this sterile water to get the excess liquid off, and I'm going to set it aside so it can dry. Okay, after I've done that, then I'm going to go ahead and remove my old sterile pre-cut gauze. Okay, after I remove that, I'm going to put it to the side. Then I'm going to go ahead and begin to clean my patient. This sterile gauze I'm going to dip in the hydrogen peroxide, and I'm going to go ahead and clean his trach. Now while I'm cleaning it, I'm going to make sure I hold on to his trach tube at all times. So I'm going to clean around. I'm also going to clean under. While I'm cleaning, I'm going to make sure I'm assessing his stoma area to make sure there is no irritation or redness, because that would indicate that there is some type of skin breakdown going on. Also, I'm going to make sure I'm monitoring all of his vital signs, his pulse ox, his heart rate, to make sure he's not desaturating during the procedure. So after I have cleaned his area, I'm going to go ahead and get another pre-cut gauze, and I'm going to dip it in the sterile water, still maintaining hold of my trach tube. Dip it in the sterile water, and I'm going to go ahead and rinse the area. Now, if it was some areas that I couldn't get into with the gauze, I will go ahead and use my cotton applicators. That's what those are for. So after I have rinsed the area, I'm going to go ahead and get another sterile gauze, and I'm going to go ahead and dry the area. Always want to dry your area because you don't want to leave it wet. That can also cause skin breakdown. So since I have dried it, and I dried under it, I'm going to go ahead and then I'm going to insert his inner cannula back in. Okay, then I'm going to get a pre-cut sterile gauze, and I'm going to put it under his area. This will be his clean dressing. So now that I have put this on here, I'm going to now remove his trach collar because he needs a clean trach collar. So I have this one ready. I'm going to take this one off. The whole time you always want to maintain a hold of the trach tube because you don't want to lose that airway. Okay. So then I'm going to sit my patient up. That way I can go move around. Then I'm going to unloose this one. And attach the new one. Okay, so now that I have attached that one, now my patient's trachea area is clean, his stoma is clean. I assessed everything to make sure there was no redness or skin breakdown or any irritation. So now I'm going to go ahead and clean up my area, put everything away. I'm going to dump everything into the garbage because you don't want to leave anything laying around. Next, I'm going to go ahead and remove my gloves. These I'm going to dispose of in the garbage. I'm also going to ask my patient, is there anything that I can get for him? Then I'll go ahead and assess his vital signs to make sure that his vitals are still normal, that he hasn't gone in any type of respiratory distress during the procedure. So now I'm going to wash my hands for 15 seconds. I'm going to document all of my findings in the chart, and then after that I'll go ahead and exit the room. I want to thank you so much for watching my video today, and have a good day.